Oh, you connected. Let me know when you can hear me. Then I'll share the screen. You hear me? Okay.
Yeah, I hear you.
Hold on, then I'll let you go.
Yeah, no worry. Are you going to join the meeting after you're done with webinar or not really?
It all depends. If she ends on time,
Yeah.
yes, but if she doesn't, no. I would try though. Because I have to pick up the kids today.
Oh. Oh.
But what time is the meeting on? At 4:30?
Um. Hi, Dr. Bess. How are you doing?
Hi, I'm good. How are you
Hi,
doing?
I'm glad to have you
How are you?
here.
Thank you.
Okay. Hi, Dr.
So we're
Bess,
starting
how
at
are you?
3, correct?
We're starting
Correct,
at
yeah.
3.
Okay, just give me a few minutes. I'll be back.
Sorry, Dr. Bess. Can you bring your screen down? We can't see you. There you go.
Yeah, just give me a few minutes. I'll be back.
Sure,
Yeah.
sure. You're good. Thank you.
Thank you.
Okay, hold on. Let me, yeah.
Oh, yeah. Okay. Thank you.
Can you see the whole screen? Okay.
Wait. The whole screen, yeah.
Oh, good. Okay. You can't see the other slides, right?
No.
Okay, good.
Let's try another slide. Just to make
Let's
sure.
try to what? Oh.
Try to move to another slide. Yeah,
All
that's
right,
good.
I got
Yep.
it. We're right?
Okay.
Like right here as you go to. Thank you, Angie.
Mhm. Are you on mute on purpose?
Yeah.
Okay.
Yeah, I just need to hit me. And the whistle.
I'm back. Here's this picture.
So Dr. Bess, can you hear me?
Yes, I can hear
Great.
you.
Okay, so what's going to happen is I'm going to share my screen. When you need to go to the next slide, just say next slide. And then I'm going to introduce you. I'm going to try to ask you 3 questions. First question is, what kind of doctor are you? And why did you decide to choose this profession? The second question will be, what do you like to do for fun? And the third question, which I think is very important, especially because you are a doctor that looks like me, is what advice, if any, would you give to women of color who are looking to join the profession? If you had a tip or a suggestion or comment, does that make sense?
Yes.
Great. All right, so I'll ask you those 3 questions in the beginning, and then you can take it away.
All right, sure.
And how do you pronounce your first name? Is it Olva or Alva?
Oliver.
Olva. Got it.
Oliver. Yes.
Oliva. Say it
Oliver.
again.
Oliver.
Got it. Got it. All right. So we have about 3 minutes.
Sure.
Hello, beautiful people. Thank you so much for joining. We're going to be starting in 1 minute. Good afternoon, everyone. Thank you so much for joining us today. We are once again very excited and proud to have our first MetroPlusHealth webinar in June. And it is on an absolutely awesome topic, which is why Blacks and Latinos have a higher risk for heart disease. We are so excited to have today our wonderful Dr. Olva Bess from Woodhull Hospital, right there, right here in Brooklyn. And so we're going to start just to get to know the doctor. So, Dr. Bess, what kind of doctor are you?
Hi, everyone. I am an internal medicine resident at Woodhull Hospital. I'm a third-year resident currently, as I said, in internal medicine.
Fantastic. And may we ask, why did you choose this profession?
Well, it's always been my interest to learn more about the human's body and learn how to prevent diseases. Like back home, so I'm originally from Guyana, which is in South America. Back home, we see so many persons with different conditions and they're not educated about it. So I've always been curious of why do you have this? Why do you have diabetes? Why does this happen to you? So the best way to fuel my thirst for knowledge was to do medicine. So I did this one.
Fantastic, fantastic. And so, what do you like to do for fun?
For fun, I like adventure activities. So currently I'm on a solo trip in Vegas, just exploring exploring the state. So I like anything that's adventure. I've done rock climbing last week. I do skating every December. I do bowling. Anything that gets the adrenaline going and just gets me active, I'm there for it.
Marvelous, marvelous. And I'm very excited you're from Guyana. I'm a GT Massive honoree, so very excited. Yes. And so as a woman of color, do you have any tips or advice for young women or men who are looking to get into the profession?
My advice for young women or men who are of color wanting to get into medicine, do it. It is a lot of work. It is a lot of hard work, a lot of nights. I remember in high school, because I'm the only one in my family that did anything with science based. So I remember crying because there's nobody else to help me with anything. So it's a lot of work, a lot of sad nights, but it is worth it. Like just seeing the change that you can give to patients, and seeing that they look on younger patients, on younger persons in general who look like you or would have been told that they cannot achieve this or this don't look at that like that is not your profession. Don't go that way. Seeing the look on their face, knowing that you've accomplished what they've been told that they cannot, I think that is above all. And then over here seeing so many patients, so many different patients all the time telling you, oh, your peers must be so proud of you. You look so young. That's just good genes. But like the whole thing with family, it helps to know that you have a profession that you feel that you've given back to the world and you can help your family and everybody else in so many ways. If you want it, don't worry about the hindrance. Don't worry about the words and thoughts that other people have. If that's what you want, that's all that matters. Go for it.
Absolutely. Well, that was excellent advice. And thank you so much for sharing your story. All right. So we are ready to begin. And so take it away, Dr. Bess.
All right, everyone. So today we'll be talking about cardiac diseases in the Black as well as the Latinx community, Latino Latinx community. So as you know, overall, heart disease is the leading cause of death. And this is within the entire world, but inside of US as well, it is the second most common cause of admissions within a hospital, and it is the leading cause of death. It has, at this point, overtaken the position of even cancers. Because this doesn't have any sex or any racial discrimination, heart disease affects everybody. So it affects males more than females, but until menopause, the rate becomes even throughout. It is postulated that the reason why it affects males more than females at a younger age is because of estrogen. So women have estrogen, and that seems to be a protective factor that prevents the progression of high blood pressure and other cardiac conditions. However, as you reach that menopause stage, that estrogen production decreases or ceases. So then your risk becomes that of a man. It's underdiagnosed and underrecognized in women with worse prognosis. So this is because most of the studies that are done, if you check most of the descriptions in most of the cardiac studies, and generally any condition really, you will see most of their subjects were men. In most cases, they were white men. They were white men, white older men. So if you look at that statistics, it pretty much depletes everybody else's value with respect to the study, because they haven't been able to postulate, like transfer that information into women. So now there are more studies coming about where they're trying to involve more women and more people of color, which will change the field entirely, because they've been analyzing everything based on the usual population, which neglects the other differences that we have. So as I said, it's underrecognized and underdiagnosed in women. And a lot of times women present differently than men. There's another reason why it's unrecognized and undiagnosed. It's the #1 killer of women, yet there's a decline in awareness from 2009 to 2019. As I said, because the women presentation is different from that of the men. Next. So this table shows the age-adjusted death rates for heart disease by race and Hispanic origin. So we see that the Black and non-Hispanic have a higher rate of death from heart diseases, followed by white, non-Hispanic, and then Hispanic, then the Asian and Pacific Highlander non-Hispanic. Next. So I placed this diagram here to show the heart disease distribution around the United States. We can see that I cannot show my pointer, but towards the lower right portion of the graph, where we can see the colors are more popping, those are more heavily populated places that have more of a mixed color population versus the other portion. And you can see those portions are even more bright in their distribution, because in those states, they have a higher rate of heart disease than in the other states that have more population of a white population. So we're going to go into a bit more of why that is so. Next. So some risk factors for heart diseases: high blood pressure. So that seems to be the #1 risk factor for heart diseases. We found that 59% of high blood pressure occurs in Blacks. 4 to 5 of Asians have uncontrolled hypertension versus 3 out of 5 of Blacks and Hispanics. 51.9% of deaths from high blood pressure occurs in women. This is again because of the under-recognized and under-diagnosis of high blood pressure in women as well. Is higher in Blacks and other race or ethnicities. Another risk factor is obesity. In the world today, especially in the more modernized countries, such as the United States, where food is much more readily available, the rate of obesity is increasing. Then we're going to go into a bit more risk factors of why that is happening and affecting more of the Black and Hispanic population more than the others. But the risk of obesity is increasing, and they found that the rate of heart disease in obese patients is even higher in Black persons, especially when they're severely obese with a BMI over 40. Diabetes, another risk factor. Hispanic, Latinx, Blacks, Asian Americans all have a higher risk of diabetes than white Americans. Hispanics are 2 times likely as whites for undiagnosed diabetes. Cigarette smoking is also a risk factor, such as also dyslipidemia, which also goes back against obesity and the food that we eat. Autoimmune diseases. So this is more of a genetic, just your body just reacting to itself. We're not quite sure exactly what would have caused it, but autoimmune diseases predispose you to increased risk of cardiac diseases. Prediabetes and metabolic syndrome. Cancer treatment. So a lot of the cancer drugs, yes, you treat one condition, but they also affect the heart in another way. Race differences. They're still not quite sure why exactly different races in itself increases your chances of heart diseases, but they've noticed that certain genes, like for instance, they know I read an article where they mentioned that For the Black population, they have a particular gene that make them more susceptible to salt. So we eat salt all the time, but being somebody of a Black race, you have a higher chance of getting high blood pressure from eating the same amount of salt that somebody else from another race does. So race differences does have some aspect to play in this. Poor social determinants of health, also a major part of risk factor for heart disease. Next slide. So this is just a diagram showing the distribution of the risk factors. Basically everything that we said just now, just in a much more colorful way. Next. So I think this is a very important slide, social determinants of health. So there are many things that influences your health. For instance, your income, if you're employed. Obviously, if you're employed, you can afford to eat better. So you eat better things, so you live a better life. You can go get yourself checked up more regularly. So all of that could influence your health. Educational status. Those who are more educated, so they say you know better, you do better. So those who are more educated take better care of themselves. They're more likely to go and get checks. They're more likely to read the ingredients on their packages. They're more likely to understand what those ingredients mean. They're more likely to do research about whatever condition, whatever symptoms they have. So the more educated you are, the better your health status is in most cases. There are the exceptions to every rule, but in most cases, the more educated you are, the more better your life is, the more healthier your lifestyle is. Access to healthcare. So again, all of these points lead back to each other in some way, somehow. So the more educated you are, the better you live in a much more affluent community. The more exposure you have to persons who will have discussions about health. The more hospitals, the more pharmacies, the more overall things about health are prevalent within your community. Living environment. Persons who live in in the underprivileged areas in the United States, they are less likely to be exposed to healthier foods, to gyms, to affordable gyms, to even playgrounds that are safe for you. If you live in an environment where there's always gunshots or inappropriate activities, then you will not feel safe having your kids there. You'll not feel safe yourself going out there. So then you're less likely to be active. So you're more likely to be at home watching television, relaxing, whatever suits you. But then that has a negative effect on your health. Access to nutritious, fresh food that explains itself. Supportive relationship. So for persons who are in an abusive relationship, that in itself has mental, physical, psychological, emotional aspects on your body and on your health in general. So the more support you have, the more family you have, the more community that you have that supports you and can give you adequate advice, that also influences your health. So remember, health is not just physical, but it's also mental, emotional, psychological. There are so many different aspects of health, and all of these factors influence your health one way or the other. Next slide. So food deserts. So food deserts are basically areas in which there is limited access to a variety of healthy foods. They are present in most low-income communities, and they're impacted by wealth, employment, incarceration, and disability. Next. So the impact of food deserts. So an article that was published in 2018, they showed that 12.3% or 15.6 million households in the US were food insecure at some point during the year of 2018. So the trends from 2001 to 2016 show that it's 2 times more prevalent in Hispanic, Black, and Hispanic Americans versus white Americans. In 2010, another study showed that it's food deserts is so more prevalent in American Indians, Alaskan Natives versus white Americans. If you notice a trend here, the white Americans have more access to pretty much everything versus the colors, what you would like to describe them. So Pew Research Center showed that white households wealth versus the Blacks and Hispanic households, they found that they were 13 times more wealth in white households than the Blacks, and 10 times more wealth in white households than in Hispanic households. Now, what this does, food deserts impacts on individuals, because it impacts your social life, impacts your physical activity and psychologically. It impacts on the society. So the less food availability of healthy foods that we have in the neighborhood means that you eat more unhealthy foods. So you eat more of the Popeyes, the McDonald's, and these unhealthy foods that they're satisfying, no doubt. They are very satisfying. They make you feel very nice, but the damage that they do to your body is on another level. You feel more tired, you're more lazy, you gain more weight, then eventually you end up not loving yourself because of those additional things that happen. So these food deserts or absence of healthy food in your communities overall makes you lower productive at your work because you're more tired, you can't really do as much, you just feel lethargic. Higher cost of public education. So in these neighborhoods, there are poor people, so they have less teachers that want to go to that neighborhood. You have less availability of resources. Education in whole becomes much more expensive. Increased healthcare costs, which explains itself as well. You're not eating well, you're not exercising well, you're more tired, you're more fatigued. So then a lot of times they also have they cannot afford to get health insurance. So they don't go get themselves checked up. The longer you wait to get yourself checked, the less frequently you get yourself checked, the more things accumulate. And the more, by the time a lot of people go to actually get themselves checked, things have reached to this extent that now it costs much more money than it would if you would have been checking yourself as regularly as you should. So overall, in these low-income neighborhoods have increased health costs because people would have waited until the last minute to then go check themselves. Next slide. So these are some parts of New York City, of New York State, that actually has food deserts. These are in Bedford, Stuyvesant, Bronxville, Brooklyn, the South Bronx, and parts of Harlem. So these areas has food deserts. As I said, food deserts are basically areas where there are less options for healthy, fresh food. Next. So heart disease in Hispanic women. So we found that nearly 43% of Hispanic females have cardiovascular disease. Almost 41% of Hispanic women have high blood pressure. Nearly 78% of Hispanic women are overweight or obese. Greater than 37% of Hispanic females have high total cholesterol. 30% of Hispanic women have diagnosed diabetes, with 41.2% with pre-diabetes. So they also, on that point, a lot of the studies show that having pre-diabetes is just as bad as having diabetes. A lot of persons think, oh, diabetes is it, but pre-diabetes is not. Pre-diabetes does predispose you to all of the risk factors that diabetes does. Just that it does it a bit slower rate, but you are still exposed to all of the risk factors. You still have all of the consequences that diabetes actually has. 6.4% of Hispanic females have coronary disease. About 2% of Hispanic women have had a heart attack. 2% of Hispanic women have had a heart attack. 1.7% of Hispanic females have had a previous stroke. Stroke led to deaths of more than 6,300 Hispanic women in 2019. Next. So now heart disease and stroke in the Black women. So more than 50,000 Black women die from cardiovascular disease annually. Stroke is a leading cause of death among Black women. Among Black women ages 20 and older, nearly 59% have a cardiovascular disease. Only 33 to 39% of Black women are aware of their signs and symptoms of a heart attack. Among Black women ages 20 and older, nearly 58% have high blood pressure, and only about 20% of those women have their blood pressures under control. Next. So now we can talk a little bit about the cardiac diseases themselves that are more prevalent amongst Black and Latino communities. So there are 5 main cardiac diseases that we'll discuss. So the main one we talk about is heart failure. So the overall statistics in the US, 6.5 million people has had a heart failure. That is 1.8% of the population from age 20 and above, with an incidence of 960,000. So 960,000 people in the US have heart failure yearly. That is 18 to 21 of every 1,000 people. To put it more simple, easy to understand, 1 to 2 of every 100 people in the US have heart failure. And they estimate that by 2030, 3 in every 100 persons will have heart failure. Now, with respect to the race breakdown, in Black Americans, 35% were male, 35 out of 1,000 males have heart failure, 39 out of 1,000 females have heart failure. In Hispanic Americans, 20 out of 10 have heart failure, 25 males out of 1,000 have heart failure. In white Americans, 19 out of 1,000 females have heart failure, 22 males out of 1,000 have heart failure. In Asian Americans, 7 females out of 1,000 have heart failure versus 17 males out of 1,000 have heart failure. Black men were 70% higher risk than white men. Black women, 50% higher risk than white women. Hispanics are more likely to have heart failure than whites. Black adults were 2 times likely to be hospitalized, longer hospital stays, and readmissions in 90 days. All of these, as we said, could be related back to the risk factors that we discussed previously. So for coronary disease, which is better known as a heart attack, Black women are more likely to have a heart attack than white women. For the deaths, Blacks are more likely to die from a heart attack than whites. So all of this has to do with the lifestyle, the community, the social determinants of health, as well as overall, it can also have some aspect to do with prejudice that occur with persons saying that Black persons or persons of color don't feel pain the way that white persons do. So then a lot of times the condition is misdiagnosed or underdiagnosed. And that is also reasons why you will find more Blacks or more non-whites being affected by heart disease, or basically most diseases, than whites. So Asians are less likely to be affected. That they're not quite sure. They think it might be related to their diet that would have attributed to their being less likely to be affected, because most of them live in the Mediterranean, to eat more Mediterranean diets, which is more healthy foods with more green leafy vegetables, which is what we actually encourage everybody to eat. For deaths, young Hispanic women with heart attack were more likely than young Hispanic men, young Black and white adults. Next. Stroke. So stroke, we should always think of, when we think of a heart disease, think about stroke, because having heart disease predisposes your chances of having stroke as well as having dementia. That's why I included these 2 on this slide as well. So with stroke, Black adults were more likely to have a stroke than all other races. Blacks are likely to be younger with stroke than other races. Mexican Americans were more likely to have a stroke than white adults or white Americans. For deaths, Black adults, Filipino adults, Japanese, Vietnamese men. So basically, everybody's more likely to die from a stroke than the white adults. For dementia, there's a twofold increase in patients with heart failure. So they believe that this may be related to the condition itself. It could be related to the underlying conditions that the patient has that would have predisposed them to that cardiac disease that later then predispose them to the dementia. Also, it can be related to their lifestyle as well that they live. For coronary artery disease, which is CAD, is associated with 40% increased risk of poor cognitive outcomes and decline. Atrial fibrillation, which is just an abnormal beating of the heart, that has an increased cognitive decline and dementia over 20 years. Because with atrial fibrillation, at certain points, your heart is beating much faster than it should, but it's not beating as fully as it should. So that means that you have like increased chances of clots within the heart. And those little pieces of clots with every beat of the heart gets sent to the brain, which then causes part of the brain to die, which increases your chance of dementia and stroke and all these other things that happen. Now, 33% higher risk in women with early menopause than with that is basically women less than the age of 40. So once you have early menopause, the thing that increases your chance of having dementia. Again, estrogen is pretty much a preventative factor for most women. Once that estrogen decreases, your chance of everything just increases. Next. So cardiac disease among Black and Latino community. So this graph was taken from an article in 2016 from the American Heart Association. So they show that the coronary artery disease has the higher risk in Black and Latino communities, followed by other diseases, which were like the dementia and these other small diseases like atrial fibrillation and other cardiac conditions. Then stroke, high blood pressure, and heart failure. Next. So how do we know we have a cardiac disease? How do we know we're having a heart attack? As we discussed before, a lot of persons in the Black and the Hispanic communities are not aware of the signs. If you don't know, then you can't prevent and you can't look out for it and you can't get treatment early. So it's very important that we know these signs. So chest pain, shortness of breath, pain radiating to the shoulders, neck, and arms, epigastric or abdominal pain. So epigastric is just basically that spot directly below your breast in female, in the middle of your abdomen. That portion, a lot of times patients have pains there, where a lot of communities is not thought of a heart condition. You just think, oh, you just have GERD or reflux, or you just have upset stomach. But a lot of times that is a sign of a heart attack. Next. So I like this picture. Can you go back to the picture, please? Yes. So this picture shows the different symptoms that present in men versus women. As I said, men present differently from women. Most of the studies originally that were done were on men. So when they did those studies, over time, we realized that we were missing a lot of women having heart disease. A lot of women were going undiagnosed or unrecognized with heart disease because they present differently. So men have the typical nausea, vomiting, jaw or back pain. A lot of persons say that they have the pain in their shoulders, radiate down the left arm, left neck, left side of the neck as well as the jaw. Men have this typical presentation. They have a squeezing pressure or chest pain, and they have shortness of breath. For women, on the other hand, women may have nausea and vomiting. Sometimes that's the only presentation that a woman presents with, nausea and vomiting, which is very non-specific. They can have jaw, neck, or upper back pain, chest pain, but not always. As I said, a lot of times they present with just nausea and vomiting, or so basically anything else but chest pain. So don't think chest pain is what means heart disease. Not always. It could be so many other things that the woman could present with. Pain or pressure in the lower chest or upper abdomen, which I described before with the epigastric region. Shortness of breath, fainting, as simple as fainting could be a presentation of a heart disease in a woman. of a heart attack more so in women. Indigestion. So women say they have upset stomach. That can be a sign of a heart attack in a woman. Extreme fatigue. You see, the symptoms that you see on the list on the right for women are much more than the men, and they're very non-specific symptoms as well. Next. So clinical presentation of a stroke. So I like this diagram here from AHA. They show like just a pictorial presentation of how these symptoms are. And it's very important that when you think of stroke that you be fast. So the patient presents with balance or coordination troubles, eyesight changes. Some may have blurry or double vision, facial drooping or asymmetry. We know most times that what most patients present with, that we heard stories, but a lot of times it's not necessarily present in everybody. They can have arm weakness, speech difficulty, and it's very important that you remember the T. The T is time is brain. So if you think the patient, what I like to tell families, if you think somebody's having a stroke, if you think that their symptoms is anything different from what they usually are, from how they usually present, if you use a family living with that person or seeing that person frequently, you know their usual attitudes, how they usually speak, how they usually look, how their usual attitude, how they usually walk. You know their baseline of everything. If there's any deviations from that baseline, and you think it's a possibility of a stroke, do not waste time. Even if you're not sure, it's better to take that person to the hospital and get them checked out rather than stay at home and wait and let's see what happens. Time is brain. The longer you take to go to the hospital, the longer you take to get evaluated, the longer you take to get treated, the more long-term deficits the person may have. So it's very, very important that you remember anything that's abnormal from what the person usually has, and you're concerned, if you are concerned about stroke, if you have any possible doubt or thoughts that it might be a stroke, take the person to the hospital. Next slide. So how do we prevent heart disease? So we've been talking all the time about heart disease, a whole lot of depressing story. So how do we prevent this from happening? So regular age appropriate checks or screenings with your primary care physician. So everyone should have a primary care physician. Yes, it's much more difficult for some persons, as we said, because of their unemployed status or their education status. So they're not aware of the possibilities. New York State has health and hospitals, which provides free or lowly reduced, low priced healthcare. So you can have a primary care physician. You can have somebody to see you regularly, even if you cannot afford it. At the hospital, I am going to advocate for my hospital because that's where I am. At Woodall Hospital, we do provide services for persons who are unemployed or do not have adequate money to pay. We have social workers in place that can help with making that. So do not let the absence of money be the reason why you have to spend more money. Because the bottom line is, if you don't get treated or if you don't get checked now, it may seem like a lot of money now, but if you let things build up and you check and it leads to a heart attack or a stroke, the money that you have to pay for rehab, for physiotherapists, for home attendant, that is much more money than you will spend than having your regular checks. So do not let the absence of money now be the reason why you're in debt in the future. Okay? So another way to prevent heart disease, nutrition or healthier foods. So more green leafy vegetables. There's a really cool documentary, forks over knives, which I think is really interesting. So basically, they're saying that the more healthier foods you eat, more green leafy vegetables, anything with a face, you should try to remove as much as possible. I like to think of it, if it can smile at you, don't eat it. So try to take those out. So you eat more fish. Just that fish is a health. So if you must have the meat in your diet, fish or chicken. If you go to chicken, meat, skinless, or avoid fried fast foods. Make it a healthier, do steamed or pot roast. Anything else that has less oil, less fats involved in it. So healthier foods always a better way to help prevent heart disease. reduce salt and sodium intake, lower cholesterol intake, weight or height, weight for height, healthy weight for height. So know your BMI. Know what is normal for you. A lot of studies have shown that your race as well determines your appropriate BMI. For someone who is African American, your appropriate BMI will be between 18 to 23. A normal BMI is between 18 to 25. But for someone who is of African American or Hispanic, we have a higher predisposition for these conditions, or a BMI cut off is lower than the average person's. So our BMI ideally should be between 18.5 to 23. So it's best you check yourself, weigh yourself. I have a scale in my bathroom that I weigh myself every day. I'm a little obsessed. But it's better to get yourself checked regularly, weigh yourself regularly, so you can adjust what you're eating and adjust your lifestyle accordingly. Exercise, 30 minutes a day daily. This is a new AHA guideline. It used to be 30 minutes a day for 5 days a week, but a new guideline is recommending 30 minutes a day daily. My advice to anybody, it is not easy to do 30 minutes a day. I'm not going to be sugarcoated. It is very hard, but it is better than doing nothing. So I prefer you to do 5 minutes a day. If that's all you can afford to do, that's all your busy schedule allows, 5 minutes a day, do that. It's better than nothing. And then slowly you increase on that until you get to that desired level of that recommended 30 minutes a day. Even if you're sitting watching television, you can do squats while watching television. You're babysitting a child. That child will love to play a squatting game with you. Use the child to do squats. There's so many ways and things that you can incorporate into your daily life to incorporate exercise. So don't make your job an excuse. You're at work. I'm at desk all the time. Okay, put your chair aside and do a standing squat at the desk. That's an exercise. You're writing. You have to pick up the computer. Do some roles with the computer. Anything you can do in life, you can incorporate it into an exercise. Simple activities. Small, as I said, even if you're at 0 now, 5 minutes a day is still better than 0. And you slowly increase to that desired 30 minutes a day. Another way to prevent heart disease, healthy sleep. 7 to 9 hours. That's what is recommended. It's not easy, but it's what is recommended. Smoking cessation. So we know smoking increases the risk of basically everything under the sun. So if you are smoking, speak to a primary care doctor. They can help you with getting nicotine patches or gums or lozenges, whatever is needed to help you quit. Get into a support group. That usually helps as well. But smoking cessation is one of the best ways to reduce your risk factors for heart disease if you do smoke. Alcohol limitation. So for males, it's recommended no more than 2 drinks per day or 14 drinks per week. For females, no more than 1 drink per day or 7 days per week. Next slide. So let's say you are living with heart disease, or you know somebody who's living with heart disease. What do? You can join support groups. So AHA has support group, hashtag Go Red Get Fit. That is on Facebook. That they have ways in which you can build rapport with people who have similar diseases. Because a lot of times, getting to know somebody who has similar disease and how they would have helped to prevent their progression, that in itself helps you to find a way to not lose hope and lose faith that you can get some improvement and some get better. Join cardiac rehab centers. These are basically exercise gyms where they have persons who are there monitoring you more closely to help you with better ways to exercise. A lot of persons are under the opinion that, oh, I've had a heart attack, it's not safe for me to exercise. No, that's not true. You have had a heart attack, you can exercise. That's not a reason for you to stop. Exercising and doing all these other preventative factors that we listed before are ways to prevent you from having another heart attack, from having another stroke. If you are concerned, speak to your doctor. They can develop a protocol in which you can follow to do an easy, slow progression of your exercise to get to that state where your heart and your health is generally better. De-stress. At the end of the day, whatever makes you able to de-stress, once it's not hindering your health, that's usually a good way to go. seek psychiatric support if needed. A lot of persons with heart disease, they do have some aspect of depression in which the entire gravity of the condition itself weighs on them mentally. So if you are feeling depressed or you're not acting the way you are psychologically, get support. There's no harm in reaching out for help. If you don't want to reach to a psychiatrist, there's always these support groups where that in itself acts as a form of support psychologically. And follow previous recommendations that we discussed before on basically how to prevent current diseases. Next. So these are my references. Next slide. And that brings us to the end of the presentation. Any questions or concerns, contributions, anything?
Well, one, thank you so very much, Dr. Best. You offered some really great information, very enlightening. I will say the beginning was a little bit scary. Being a woman at my age and seeing all of the different things. So for me, I want to say thank you so much. It was a reality check, and I think it's a reality check that we all need. I'm so grateful and thankful that we have this webinar series so that people have the access to the information. So thank you so much for your time. We greatly appreciate it. At this time, if you do have a question, I ask that you please unmute and you can feel free to ask your question. Or if you want, you can place your question in the chat and we will ask it for you. I do see a question in the chat, but I will start off with saying, is there a way to reverse if you have a cardiac disease? Meaning, like, is there a way to kind of like, let's say, God forbid, if you did have a heart attack, what can you do now to make sure that you don't have another one?
The preventative measures that were listed. So if you've had a heart attack before, it's just a matter of changing your entire life from what you were accustomed to. Think about what you were doing before that were not healthy. If you had a heart attack before, were you going to the doctor as regularly as you're supposed to? If you were not, start doing that. Were you taking care of your health the way you were supposed to? If you were not, start doing that. Were you exercising regularly? Are you still smoking? If you are, stop it. Are you drinking excessive alcohol? Are you sleeping more regular than usual? Are you have a lack of exercise? Are you eating more salt, more unhealthy food? Are you always at a fast food instead of cooking fresh food at home? Are you eating more of carb-heavy food or highly processed food? If you are, then cut those out. So the more green leafy vegetables you eat, the more food that is devoid of fat or unhealthy fats. That is a better way in which you can prevent yourself from having another heart attack or another stroke.
Great. Thank you so much for that response. We have a question in the chat, which is there an age that is most common for heart issues?
So they're not a particular age. What they found is that, as I said, most of the population that had heart failure were from 20 and above. So they found that mostly persons who are over the age of 50, in most cases, those were the ones who have had a heart disease. But it could be younger if you have more risk factors. So if you were smoking, if you were doing drugs, if you were non-exercising, if you're eating all of the fast foods, they actually have I was surprised to see over here in Vegas, they have a restaurant called Heart Attack Restaurant, and where they encourage you to eat once you're over 350 pounds. So if you're doing things like that, and you're just eating your weight in food, then yes, that would increase your chance at a much younger age of having a heart attack. You can be 20 with a heart attack if you're not taking care of yourself. So it can occur at any age. Most cases it occurs in persons who are older, but it is not surprising to see younger persons with this because recently we've had an increase in childhood obesity. So that increases your chance of getting a heart attack.
Understood. And our next question is, when should we get checked or how often should we get checked for heart issues?
So, as I said, the risk factors increase the chance of heart disease. So the doctor will not check you directly for heart disease, but check you for these risk factors that increases your risk. So if you are young, it's never too late to get checked. I get my physical every year, once a year, and that's my schedule. If you have comorbidities, it may be more frequently that you have to see your doctor. See your primary care physician and they can set a schedule for you. But everyone should be seen by a doctor at least once a year. That is the least that you should be seen by a doctor. Even if it's just to pop in to say hi. Just so the doctor can check and make sure that your blood pressure is well, that your BMI is appropriate for your weight, and you have all the age-appropriate screenings and age-appropriate vaccines. So everyone should be seen by a doctor at least once a year.
Understood. Thank you so much. So I'm going to open up and pause to see if anyone that we have on the call right now would like to ask Dr. Bess a question. Please feel free to unmute. All right. Well, Dr. Bess, thank you so much again. We truly appreciate having you. I'm definitely grateful that you were on vacation and you took the time to give this presentation. Funny enough, next month, I will also be in Vegas for my bachelorette party. So I hope that you have a good time. I know it's hot out there. It's usually around like in the hundreds.
Yes, it's very hot.
Yes. But thank you so much for taking this time. And absolutely everyone knows I'm a very proud Brooklynite. And so I always rep very hard for Woodhull Hospital. I literally, my Brooklyn apartment is about 10 minutes in walking distance away. So always telling people, you know, it's a hospital that I remember from my younger days. Everybody knows 760 Broadway. And so, you know, please feel free to understand that Dr. Bess is there with this wonderful information. I would assume that you're still taking patients. Is that correct?
Till the end of the month, yes.
Good to know. So please feel free if you're looking for health insurance, whether it be low cost to free, keep us in mind, MetroPlusHealth. We are the city's health plan. We are a health insurance plan that is for New Yorkers by New Yorkers. And so we are once again so grateful and so thankful to have you, Dr. Bess. We look forward to partnering with you again. And congratulations. I can say I am extremely proud of you. I know your family is as well. And keep on doing what you're doing. And everyone, let's please try to stay heart healthy. If not for yourself, for the people that love you. Take care, everyone, and have a good one. Bye-bye.
Thank you, everyone. Bye.
Thank you. Bye-bye. So, Dr. Bess, this was recorded. Once we edit it and get everything, you'll be able to send it out to the masses.
Okay, thank you.
Take care. And now, wait a minute. I just want to make sure. During Christmas time, it's all right to have a little pepper pot.
Of course. Just a little bit.
Just a little bit. Just a little bit. All right. Take care. You have a good one. And thank you so much again.
You too. Have a good day. Bye.
Bye-bye.